very good morning to all. Today we will discuss about a very important topic, that is ICU care bundles. What are they and why use them? What are the ICU care bundles? Let's see. Florence Nightingale once said, the very first requirement in a hospital is that we should do the sick no harm. That is, the first requirement is that we should not harm the patient. After that, the treatments are normal. Okay. So what are the bundles? What does the bundle means? A bundle is a group of evidence-based care components for a given disease that, when executed together, may result in better outcomes than if implemented individually. That is, a bundle is a group of components which are evidence-based, which are with practice, with evidence, with proof, with studies, it has come. And if we apply them together, we can do a good benefit to the patient, and patient will have better outcome than implementing them individually. So in a bundle, the individual elements are built around best practice, best evidence-based practices. That is, these bundles are prepared with good evidence, and the science supporting the individual treatment strategies in a bundle is sufficiently mature such that implementation of the approach should be considered either best practice or a reasonable and generally accepted practice. That is, these bundles are prepared in such a way with good evidence, that is, it can be considered a best practice or a reasonable practice, and it can be generally accepted. So what are the importance of care bundles and why we need them? First, if we apply these bundles, this will benefit to the patient. It also reduces the ICU stay of the patient. It reduces the cost of the patient. It improves resource utilizations, best practice, and clinically effective. So what are the bundles? Bundles are ventilator bundles, which we call Vapii bundles, central line bundles, which we call Crbsi bundles, sepsis resuscitation bundles, sepsis management bundles, and catheter associated urinary tract infection bundle, that is Cauti. So these are the bundles. Here we'll discuss 4 bundles: ventilator bundles, central line bundles, sepsis resuscitation bundles, and Cauti. So what is Vapii? First of all, let us know what is Vapii. Vapii is defined as a pneumonia that has developed in a patient who is on mechanical ventilator for at least 48 hours after endotracheal intubation. That is, we can say a patient has developed Vapii when we find that patient is having fever, having a lot of secretions. Along with that, the laboratory report is also positive, that is, culture is positive, and along with that we have chest X-ray also showing pneumonia after 48 hours of intubation. Then only we can say Vapii. If it is within 48 hours, that is, patient is intubated today and tomorrow we are seeing that patient has developed a pneumonia, then we cannot say it is Vapii. That is, at least the patient should be on ventilator for 48 hours. After that, we can see it is Vapii. Okay. So what are the Vapii bundles? That is, what are the bundles will follow to prevent the ventilator-associated pneumonia? Keep the patient head in elevation. That is, at 30 to 40 degree, 45 degree, keep the patient elevated so that it prevents aspirations. And oral care with chlorhexidine. That is, we have to care the patient, or do oral care with hexidine, with chlorhexidine, which we use. That is 0.12% chlorhexidine, we do oral care. Stress ulcer prophylaxis. That is, we give pantoprazole. Daily sedation interruption. That is, we have to stop the patient daily sedation. If possible, we should stop the sedation daily and allow the patient to breathe spontaneously. Because if we keep the patient sedated for long, paralyzed for long, then the patient will high chance of developing pneumonia, and high chance of patient ICU stay is also prolonged, ventilator stay is also prolonged. And also DVT prophylaxis. That is, we should give a DVT prophylaxis to the patient. And also, if the patient is having supraglottic suction port, we should better use endotracheal tube with supraglottic suction port, and with that port do suction frequently to prevent aspirations. So these are the things, if we practice, we can prevent to some extent Vapii. Next comes central line associated infections. It is called Crbsi. It is central line associated bloodstream infections. It is a laboratory confirmed infection. That is, laboratory confirmed, that is, the blood sample has come positive for organisms, whereas central line is in place for more than 2 days, that is more than 48 hours prior to positive cultures, and is also in place the day of or day prior to cultures. So the main thing is that the patient's central line is there for more than 48 hours, like the VAP. That is, in VAP also it should be more than 48 hours. Here also is more than 48 hours or more than 2 days. Central line should be there, and the central line sample is positive. Along with that, the peripheral blood sample is also positive. Then we can say that patient has developed central line associated blood stimulation. So what are the bundles which we, if practice, we can prevent this central line blood infection? These are hand hygiene, that is proper hygiene of the hands, very important. We cannot replace with anything. Maximal barrier precautions, that is, we should put, when we give a central line, put on cap, put on mask, put on gown, put on gloves. Okay, properly drape the patient, properly clean, antiseptic cleaning with chlorhexidine. Optimal catheter site selection, that is, if we give subclavian vein central line, then the chances of infections are less. But if we give subclavian central line, we have to be very careful, because we might end up with pneumothorax. So most of the time in some hospital they only prefer IGV, because chances of pneumothorax is less. Next, daily review the line. That is, daily see whether we can remove the line. Also, daily inspect the line. That is, whether there is, that is why it is very important to put on the tegaderm, not a dynaplast or like that, so that you can cover it. If you put a dynaplast over there, it is covered and you cannot see whether what is there beneath, what is there under. Okay, so always put a tegaderm, so that tegaderm is a transparent dressing where we can see that whether the line in the line, whether there is any pus, whether there is any redness, whether there is any swelling, so that we can be aware that the patient might develop central line infection. Okay, and frequently see if there is any oozing, or if there is any oozing, then we might need to change the tegaderm dressing. Otherwise, we can change it every 96 hours. So hand hygiene, maximum barrier precautions, chlorhexidine skin antiseptic dressing, optimal catheter site selection, and daily review of line necessity. So these are the central line, that is CRBSI bundles. These bundles, if we follow, we can prevent infections of the line. Next comes Cauti, that is a catheter study. When a catheter is there in place for more than 2 calendar days on the date of event, it is the same. It is, if the catheter is there for more than 48 hours and the patient urine sample taken from the catheter is positive, then we can say it is Cauti. So all VAP, central line associated bloodstream infections, Cauti, all are all says that if the sample should come positive after 48 hours of putting the line, or putting the ventilator, or putting the catheter. So infection in the urinary tract infection system, including the bladder and the kidneys. Cauti is saying that there is infection. It can be infection in the urinary tract system, it can be infection in the bladder, it can be infection in the kidney. But the catheter should be there for more than 2 calendar days. So how can we prevent Cauti? What are the Cauti bundles? We can remember it like this: no Cauti, and stands for need. So first of all, assess whether the catheter is really needed or not, or if we can give it, if manage with something else, like we can put on condom catheter, or we can ask the patient to urine by himself. Second, if you have decided that you have to give the catheter, then obtain a patient consent. That take a consent from the patient and educate him that how you are going to give the catheter. Second, competency. That is, the person who is going to give the catheter, he or she should be competent enough to give the catheter. Second, aseptic measures, that when you give the catheter, maintain asepsis during insertion and while catheter is in place. It's very important. You have to frequently see whether you have maintaining the aseptic measures. Unobstructed flow. That is, there should not be any blocking, any kinking, loop. Okay, and catheter is secured. That is, you should be secured to the body of the patient. That is, you can secure in a thigh or anywhere, so that the catheter is not pulled. And the back should be below the level of the bladder. That is, it should be below the bed, and it should not touch the. Okay, and T stands for timely catheter removal. That is, timely remove the catheter when it is not required. I, infection risk. That when we are suspecting infections, they collect the sample only when there is infection risk and when doctor says when it's indicated. So lastly, the sepsis bundles. Sepsis bundles, when a simple infection, if a patient is having a simple infection, urinary infection, we don't say that it is sepsis. Sepsis we say when the patient is having infection and it has involved the organs of the patients. That is, it is it is damaging the kidney, it is damaging the lungs, liver, etc. Then we say that patient is landing. So sepsis, by definition, sepsis is life-threatening organ dysfunction caused by a dysregulated host response to infection. That is, because of the infections, the body of the patient has a response, inflammatory response, because of which the patient is having life-threatening organ dysfunction. That is called. So, what are the sepsis bundles we should follow to prevent uh, sepsis bundle? We should follow when the patient of sepsis comes to us. That is, immediately when the patient of sepsis comes to us, what we do: collect blood sample from collected, obtain blood cultures immediately, and administer antibiotic immediately. But if we have to delay for some reason, the blood culture have to delay, in that case you give the antibiotic first. You cannot wait for more than 1 hour. Yes, we have 1 hour time. Within that, you have to give the antibiotic. You have to give the blood cultures. Okay, and it is very important. The earlier you give the antibiotic to the patients, the earlier, the better is for the patients, and better is the chances of survival of the patients. That is very important. Next, give fluid to the patients at the rate of 30 ml per kg body weight when we see that this patient is requiring this amount of fluid. But you have to titrate, not always 30 ml per kg body weight. You have to titrate accordingly. That is, we cannot give all the patients at the rate of 30 ml per kg body weight. We have to give fluid, but we have to see whether how much fluid this patient is requiring. And along with that, you have to see the lactate. If it is more than equal to 4 millimole, that is short. Then apply vasopressors whenever it is required. That is, we have given fluid, the patient's BP is not improved, start vasopressors. Or when the patient is in severely hypotension, that is BP is systolic BP is less than 80, less than 70, in that case start the vasopressor, along with that give fluid. Very important, time is very important to maintain that. So here we have discussed today the web bundles, the central line bundles, the Cauti bundles, and the sepsis 1 hour bundles. See, this is very important. These topics are very important for any patients in ICU, and we get most of the patient in ICU. We get this type of patient, that is sepsis patients, and we have to follow it. The web bundles to prevent pneumonia to the patients, Cauti bundles to prevent urinary infection to the patients, and to prevent central line infection to the patients. We have to follow the central line bundles, along with the sepsis 1 hour bundles, also very important to decrease the mortality. So it's very important, always remember these points. Okay, thank you, thanks a lot.